Keratitis is an eye condition that involves inflammation of the cornea, which is the clear, transparent front part of your eye. Think of the cornea as the window of your eye. It's the first thing light passes through when entering your eye, and it plays a crucial role in focusing that light so you can see clearly. When this window becomes inflamed, it can cause a range of uncomfortable symptoms and potentially threaten your vision if not treated properly. The term keratitis comes from two parts: kerat referring to the cornea, and itis meaning inflammation. So, at its core, keratitis is simply inflammation of the cornea. Types of keratitis. Keratitis can be broadly divided into two main categories based on its cause: infectious keratitis and non-infectious keratitis. Infectious keratitis is caused by microorganisms invading the cornea. It is further divided into several types. Number 1. Bacterial keratitis. Bacterial keratitis is often associated with contact lens wear, especially if proper hygiene isn't maintained. It can progress rapidly and cause serious damage if not treated quickly. Number 2. Viral keratitis. Viral keratitis is commonly caused by herpes simplex virus, which is the same virus that causes cold sores, or varicella zoster virus, which causes chickenpox and shingles. This type can recur over time and may require long-term management. Number 3. Fungal keratitis. Fungal keratitis is less common in temperate climates but can occur, especially in people with compromised immune systems or after an injury involving plant material. Number 4. Acanthamoeba keratitis. Acanthamoeba keratitis is caused by a microscopic parasite. While rare, it's most often seen in contact lens wearers who use tap water to clean their lenses or swim while wearing them. These were the types of infectious keratitis. Non-infectious keratitis, on the other hand, can result from conditions such as dry eye, allergies, or exposure to harmful UV light. Causes of keratitis. The root cause can vary depending on the type, but there are several common factors. Contact lens wear is a significant risk factor, especially for bacterial and acanthamoeba keratitis. This doesn't mean contact lenses are inherently dangerous, but improper use or poor hygiene can increase the risk. Injuries to the eye, even minor scratches, can also open the door for infection or cause non-infectious inflammation. Certain viruses, as mentioned earlier, can also cause keratitis. If you've had cold sores or shingles, the virus can sometimes reactivate and affect your eye. Additionally, contaminated water, particularly in warm climates, can contain microorganisms that can infect the cornea. This is why it's important not to swim or shower while wearing contact lenses. Weakened immune systems, whether due to diseases like HIV or medications like corticosteroids, can also make you more susceptible to infectious keratitis. Non-infectious causes of keratitis include dry eye syndrome, where insufficient tear production leads to corneal dryness and irritation, and allergic reactions, which can cause inflammation and discomfort. Prolonged exposure to ultraviolet light, such as from sun lamps or welding torches, can also result in a type of keratitis known as photokeratitis. Additionally, autoimmune diseases such as rheumatoid arthritis and Sjogren's syndrome can contribute to the development of keratitis. Symptoms of keratitis. Many people describe a feeling of something being in their eye, like sand or grit. This foreign body sensation can be quite uncomfortable and may make you want to rub your eye, which you should avoid as it can make things worse. Pain is another common symptom. It might start as a mild discomfort, but can become quite severe in some cases. The pain might worsen when you're in bright light or trying to read. Your eye might become red and inflamed. This redness can be mild or quite noticeable, depending on the severity of the inflammation. Excessive tearing is common as your eye tries to flush out whatever's causing the irritation. On the flip side, some people experience a decrease in tear production, leading to a gritty, dry feeling. Vision changes are a serious symptom to watch for. Your vision might become blurry or hazy, or you might see halos around lights. In severe cases, you could experience a significant loss of vision. Sensitivity to light, or photophobia, is another common symptom. Bright lights might cause discomfort or even pain. Some people experience swelling of the eyelids, which can make your eye feel tight, or uncomfortable. It's important to note that these symptoms can come on gradually or appear suddenly, depending on the cause and type of keratitis. Some people might experience mild discomfort for days before seeking help, while others might wake up with severe pain and immediately know something is wrong. If you're experiencing any of these symptoms, it's crucial to see an eye doctor promptly. Keratitis can progress quickly, and early treatment is key to preventing complications. Diagnosis of keratitis. Diagnosing keratitis involves a comprehensive eye exam. Your doctor will start by asking about your symptoms and medical history. They'll want to know about any recent injuries, contact lens use, or exposure to potential contaminants. Next, they'll examine your eye using a special microscope called a slit lamp. This allows them to get a magnified view of your cornea and look for signs of inflammation, injury, or infection. They might use special dyes like fluorescein to highlight any damaged areas of the cornea. In some cases, your doctor might take a small sample from your cornea to test for specific bacteria, viruses, or fungi. This can help determine the exact cause of the keratitis and guide treatment. Your doctor might also check your vision and the pressure inside your eye, as keratitis can sometimes affect these. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for keratitis. The specific treatment will depend on the cause and severity of your condition, but here are some common approaches. For bacterial keratitis, antibiotic eye drops or ointments are typically prescribed. These might need to be applied frequently, sometimes as often as every hour in severe cases. Viral keratitis is often treated with antiviral medications, which can be in the form of eye drops, ointments, or oral medications. Fungal keratitis, on the other hand, requires antifungal medications, which might be applied topically or taken orally. Acanthamoeba keratitis can be challenging to treat and might require a combination of medications. For non-infectious keratitis, treatment might involve corticosteroid eye drops to reduce inflammation. However, these are used cautiously, as they can sometimes worsen an infection if one is present. In cases of dry eye-related keratitis, artificial tears and ointments are used to keep the eye moist. Sometimes temporary patching of the eye or even surgery to help the eyelids close properly might be necessary. In all cases, pain management is an important part of treatment. This might involve oral pain medications or special eye drops that provide numbing relief. For contact lens wearers, you'll need to stop wearing your lenses until the keratitis has fully healed and your doctor gives you the okay to resume use. In severe cases, or those that don't respond to medication, more intensive treatments might be necessary. This could include a procedure called debridement, where the damaged outer layer of the cornea is carefully removed to help promote healing. In rare, very severe cases where significant scarring has occurred, a corneal transplant might be necessary to restore vision. Recovery and prevention. Recovery time can vary widely depending on the type and severity of keratitis. Mild cases might clear up in a few days with proper treatment, while more severe cases could take weeks or even months to fully resolve. As for prevention, it simply involves adopting good eye hygiene practices and taking measures to protect the eyes from potential hazards. For contact lens users, this means adhering to recommended cleaning and replacement schedules, avoiding overnight wear unless specifically prescribed, and ensuring lenses are stored in a clean, disinfected case. Protective eyewear should be worn during activities that pose a risk of eye injury or exposure to harmful UV light, such as sports, construction work, or using tanning beds. Now, we want to hear from you. Did you or someone you know have keratitis before? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.